Health Center with Dr. Gerald Dees is sponsored by the State University of New York Downstate Medical Center. SUNY Downstate, located in East Flatbush, is one of the 64 campuses in the State University system. Housed on this urban campus is the only medical school in Brooklyn. More New York City doctors graduated from Downstate than any other medical school in the country. Our College of Health-Related Professions offers training as diagnostic medical imaging technologists, midwives, health information managers, occupational therapists, physical therapists, and physician's assistants. We have a 2-year upper division bachelor program in our College of Nursing, and it offers a Master's of Science degree in advanced nursing practice. Downstate is a major scientific research center with a School of Graduate Studies, where some of the world's best scientists are trained and teach, including Dr. Robert Furchgott, the 1998 winner of the Nobel Prize in Medicine. Our University Hospital of Brooklyn now has an emergency room open 24 hours a day, 7 days a week. University Hospital is known for its centers of excellence in kidney disease, cardiovascular health, neurology and neurosurgery, primary care, women and children's health, and asthma. For excellence in patient care, education, and research, you can depend on Downstate.
Hello again, everyone, and welcome to Health Center from Downstate Medical Center in Brooklyn. I'm Lorraine Brooks, and I'll be your host for today's show. And it's my pleasure. I'm going to be talking to one of my esteemed colleagues here at Downstate who I have done shows with in the past where she has interviewed me. But today we're turning the tables a little bit, and I'm going to be interviewing her. Her name is Julie Black-Peart. She is assistant professor and senior clinical coordinator of our physician assistant program here at Downstate Medical Center. I know that a lot of you may not even know what a physician assistant does, and maybe when you go to your own doctor's office, you're seen by a physician assistant, and you might not even realize that. I know that my physician has a physician assistant who does the basic exams, the blood pressure and the vital signs and things like that. But I know that they can also do other things. And so one of the things we're going to talk about today with Julie is what do physician's assistants do, and why you should come to Downstate to become one. So Julie, welcome to the show.
Thank you for having me.
It's always a pleasure for us to talk.
This is just a casual conversation because we see each other in the hallways here, and we've known each other for quite some time. But I'm glad to come and talk to you about this subject, which is near and dear to my heart.
I know it is, and as you say, we see each other all the time, and
Yes.
you know, there are thousands of people who work here at Downstate. I don't know if people realize that, but it's a big institution with a lot of people who do a lot of different things, and even though we know each other and we work together on a lot of different projects, we often don't know exactly what the other person does.
That's true.
So why don't you tell us a little bit about, first of all, what is a physician assistant?
Okay. Well, as you said, a lot of people go to their healthcare practitioner. It may be a doctor, but a lot of times people are not aware that they actually see a physician assistant. Okay, we'll wear the same scrubs or same lab coat, whatever have you. And what we're doing is we're providing a high level of quality patient care to any patient who needs our help. The beautiful thing about this career path is that it's based on the medical model. And it's kind of like going to medical school, but in a much more condensed fashion, where the students really learn all of the salient and important things that they need to know about how to recognize, diagnose, and treat any type of medical illness or problem.
So if you're a physician assistant and you would be able to do a history.
Absolutely.
Right? So when a person comes into a doctor's office, you might be the person who asks the initial questions and does
Yes.
the initial interview, takes the history. And then what would you do? Do you need to report that to the physician? Do you have autonomy? I mean, can you prescribe? Can you refer?
Yes.
Can you?
Yes. Right. So let's take it back. Like I said, this is based on the medical model. So
What is the medical model?
Well, you know, people go to medical school. There's nursing, and then then there's medicine. A medical model is much more in depth in terms of the types of what's the word I'm looking for? Care that we can give, and we can give it across the board in a lot of different areas and expertises of medicine. Right. So, like you said, we do histories. We will order tests. We will read and interpret those tests. We can prescribe medications on various different levels, not just your regular antibiotics, but in some states we're even able to prescribe narcotics, okay? And the thing about practicing is that every state has its own rules. So say, for instance, a PA here in the state of New York may be able to prescribe medications at a higher level than a physician assistant who practices in another state where perhaps maybe they're not allowed to do that.
Now, when you say a higher level, you mean, for example, narcotics, triplicate
yes.
prescriptions and things
Right,
like that?
that sort of thing, right. So we'll interpret those tests. We will have follow-ups with patients, and you can find a physician assistant in just about any area of medicine that you can think of, from internal medicine in the hospital to surgery, to women's health, obstetrics and gynecology, to dermatology, to pediatrics, to hematology, oncology, just about anything. And that's really the beauty of this career. Because we're trained across the board, we're actually able to work in various different areas of medicine. Unlike your physician who we team up with, because there is this physician PA team, okay? We are not allowed to necessarily work without a sponsoring physician, and I'll touch on that a little bit more because there is a certain level of autonomy to that. But that because we can work in all these different areas, I can say, for instance, work in family practice medicine 3 days a week, and then maybe do a per diem or a part-time job at a pediatric office as well. When you decide on becoming an MD, you pick a track of medicine, and that's it. That's all that you can practice.
And we call that a residency, right?
Yeah,
when
that's
you
a
graduate
residency
from, just so
program,
people
right.
know, when you graduate after 4 years of medical school, which we also have here, a
Yes.
College of Medicine,
A wonderful
and a very good one indeed. After you graduate from a 4-year medical school, you get an MD degree,
Right.
and then you go on from there and you choose a specialty, and that's what we call a residency. When you
Right.
go in for another 4 years or so, and you concentrate on that one area of
Right.
medicine, like pediatrics or dermatology or
Right.
OBGYN. But what you're saying is when you're a physician assistant, you don't have to, you've already gotten that broad education, that broad base, so you don't need that extra training time.
No.
Correct?
You don't
Okay.
need it, but they do have fellowship programs for people who do want to specialize in things like surgery or emergency medicine. There are actually some physician assistant programs that are just surgical based. Physician assistant programs. We have a couple of those here actually in New York. But because of the way that we're trained, say for instance here at SUNY Downstate, our students will do 6-week rotations in internal medicine, general surgery, pediatrics, obstetrics and gynecology, family practice medicine, emergency medicine, and then they'll also do rotations in psychiatry, geriatric medicine, and then they get 2 subspecialty electives that they'd like to choose. So if you're interested in dermatology, or if you're interested in cardiothoracic surgery or cardiology or something like that, you get an opportunity to spend some additional time working with the teams in those different areas. And we send our students, since I'm the senior clinical coordinator, we send our students to a lot of the hospitals right here in the general New York area. So the students will go to Downstate, of course, that's our home, Kings County Hospital, which is across the street, Interfaith. We have students go to the VA hospital in Manhattan, Interfaith Medical Center, Lutheran Medical Center, and a host of private practice doctors' offices in various different areas.
So when you're, take me through the steps that one has to go through to become a physician's assistant. When you apply to a school like ours, you're accepted into the program, and then you have to take a certain amount, I would assume, of core courses or
Right.
just general courses that everybody takes.
Right.
And then you have these clinical rotations where you get to experiment with, well, not experiment, that might not be the right word, but you get to experience
yes.
different specialties.
Right.
So that you can then decide what suits you best.
Okay.
Correct?
Well,
Is that correct?
Yeah, for
Okay.
downstate, yes. Now, each program has their own method of interviewing and accepting students. Some programs are longer than others. The program here at downstate happens to be 2 years and 3 months.
Full time?
It's full time. So anyone who is considering making physician assistant a career path really must have a level of dedication and be prepared. You can't work and come to this is your job. If you decide to be a PA student, it becomes your job. So support from family and friends is extremely important if you decide to come to PA school. We require our students to come with certain prerequisites. Some of our applicants come to us with degrees already in various areas such as respiratory therapy or biology, or they may be an EMT before they come to us. But some come and they don't have degrees as yet, right? And an important thing to know is that our program, and actually there's a national mandate, all PA programs will be master's degree programs.
So is it a combined bachelor's
It'll
and
be a BS to
master's?
MS degree program here, yes. So they come to us, they
That's
have
a lot
to
of
have,
work to do
it
in
is.
2.5 years.
It is,
Yeah.
it's really crunch time.
Sure.
Before they apply, they must have biology 1 and 2 with labs. They have to have microbiology 1 and 2 with labs, anatomy and physiology. They have to have lifespan psychology, and they have to have some humanities, mathematics, and various other courses before they can even apply, all right? And the other thing is that we like to see people have a commitment to healthcare and a commitment to community. So we also require a certain number of hours of community service that's non-health related. And a certain
As a prerequisite
Yes.
for admission?
Yes, for admission,
Wow,
yes.
okay.
And a certain number of hours for students to show that they've had some sort of experience working in some sort of healthcare related facility, whether they're candy striping or whether or not they're shadowing a physician assistant or a doctor in whichever area it might happen to be. We'd like to know that people have a good understanding of what the field is all about before they apply. They put the applications in, those are screened. Some people will be invited for a sit-down interview, and others may not, all right? But those who are invited for an interview are further screened, and then we take our class of students.
How many students do we admit
Right.
usually on a...
Well, ideally a class would be 35. All right. We maintain a small cohort here because we like to have a small student to faculty ratio.
How many faculty
And,
do you have?
Right now there, oh my goodness, let's see, there are 1, 2 part-time and 1, 2, I have to count them. I think it's 5 full-time faculty members. I hope I'm right.
So
I never
that's
really
a pretty,
think about
that's
the
a pretty
number that
good
much.
ratio then.
It
I
is.
mean, that's
Yeah.
about 7 faculty people to 35
Yeah.
students. So that's a pretty good ratio. So they get very specialized and detailed attention
Right.
from the faculty. That's very good.
Another thing is that most of our faculty members are graduates from right here at Downstate, including myself.
Even better.
Even better.
What year did you graduate?
2000. Yeah.
Okay.
It was kind of a late decision for me. I was doing other things, and I had a mentor who kept telling me, forget about that other stuff. Get into medicine. And I came here. The school offers information sessions, which anyone is invited to come and learn more about the allied professions that we offer here at SUNY Downstate, including physician assistant. We can come and get more information, ask questions, and
Meet the
learn,
faculty,
meet,
talk to
meet
people,
some faculty, yes.
Students, people who are doing the actual work.
Right.
I know we had, I just want to mention this, we a couple of weeks ago had what we call a white coat ceremony.
Yes.
Which is where incoming students receive the white lab coat that you see people wearing in practice. And I think that's a wonderful way of accepting people into the field, into the profession. Is there a difference? I know there's a difference in medicine. I don't know if there's a difference with PAs. And when you come in to medicine, you get the short jacket, and then when you graduate, you get the long one, right? Is there a difference in PAs, or?
There is not a difference.
Okay.
PA students who are currently in school will also wear a short white jacket.
White jacket,
Yes.
okay.
Once you become certified, you get to don a long jacket.
Okay, so then it is the same. Once you graduate from medical school, you get
Yes.
So if you see someone coming towards you with a long white coat, they could be a physician or a physician assistant.
Yes, but you know how you
How
will
would
know?
you know?
You will know. The law states that we must identify ourselves as such, all right? And that means that not just to come up to you and introduce myself as a physician assistant, but we have to have a tag on or some sort of a label that's clearly recognizable that says that you're either spelled out physician assistant, and the letters that you will see behind our name is PAC, which stands for Physician Assistant Certified, and
Okay.
some people use RPAC, which means Registered Physician Assistant Certified. But basically, it's the same thing, right?
Where do you get registered with the
Well, the state of New York, yeah,
Department of Health? Or-
yeah, they will do that for you. And once you've completed all of the requirements of any physician assistant program, you then go and you sit for your state board exam. Okay, so that's the PANCE exam, the Physician Assistant National Certifying Exam. Okay,
PANS.
so that's the PANCE exam, and then every few years, PAs have to do continuing medical education. These are courses that we read. We go to grand rounds, we read journals, we do various other things, because medicine is constantly changing and moving. You must stay up to date, okay? You cannot practice and do the best for your patients, giving them the quality of care that they deserve, if you're not knowledgeable on what the current standards are in medicine. So it's required of us, and it's required of medical doctors. They also must do that, and nurse practitioners. Okay, so we do have to have CMEs. Yeah. Oh, you want to know what about nurse practitioners?
What's the difference between a nurse practitioner and a PA?
Okay. Well, one of the major differences about PAs is, once again, the ability to move around from different specialty to different specialty. Nurse practitioners often will work in family practice, or they'll do pediatrics, but they too pick a specialty area, and that's where they're zoned in. You won't see them moving around all over the place into different areas. And I don't mean in such a way that it's willy-nilly. It's very chosen when you decide that you want to work in one area and have another one maybe as a side job for per diem or stuff, which is, it's just wonderful. It gives you an opportunity to expand your knowledge, and there's some flexibility and whatever have you in terms of practice parameters.
So if I know we do a lot of outreach to local high schools and young people who are thinking of getting into science and healthcare, allied healthcare professions. What kinds of things should we be telling our young people, our high school or even junior high school kids, if they want to pursue a career as an allied health professional? What kinds of things should they be taking or looking at or thinking about when they're in high school, so when they come here they'll be more prepared?
Yeah, absolutely. Well, definitely they have to be strong in the sciences. You know, when we look at a person's application, we do look at their transcripts. We look at their college transcripts, and
so you need a BA degree before you...
No, you do not actually, right now, you do not have to actually have a BA degree to apply to this program. You have to have the prerequisites, though, and you have to, it's really good for people to show that their volunteerism and their interest in healthcare is not really something that they just looked up PA one day or somebody told them about it, you know. And for some people, it's really just that cut and dry. But if you have a background of that spans back into your high school years, where you're constantly volunteering and doing things and engaging in your community and candy striping or whatever it is that we do, that's a really nice thing to see on an application. It doesn't mean that somebody wouldn't get in because they don't have it, but some people, it comes from here. It's to me, at least for me, it's more from here than it is from, you know, oh, this is something that's going to get me a whole lot of bucks, because PAs can do quite well for themselves. You know, some of the specialty areas, cardiothoracic, cardiology, dermatology, can garner you a nice salary, but it's never about the money when it's healthcare. It has to be about more than that, and a willingness to want to care for people and serve and do the right thing.
And be dedicated to it.
Yes, absolutely.
It's not an easy profession. It's not an easy thing to do. You're involved in literally life and death situations.
Absolutely.
And illnesses, and helping people get through illnesses, and it can be very taxing and very you know, it can take a lot out of you if you have to be a dedicated person, which is why we have an employee assistance program, which is what I do, because we recognize the fact that when you work in this kind of environment, there are a lot of stressors that you know, that can impact your ability to perform. But getting back to what you can do to prepare, you said the sciences, so that would be like biology, chemistry, things like that. I took chemistry way back when. I loved it, and I have to, I'm going back a long time, obviously, but when I was in high school, I loved chemistry, and I did very well at it. And no one ever suggested to me that a career in science might be a good idea. And, you know, I'm not you know, I'm not saying it was a good thing or a bad thing, but I think that a lot of times when you have something that you're good at or that you're interested in or that you have some ability in, that, you know, the guidance counselors could pick up on that and say, hey, listen, you know, you're good in science. Why don't you think about
A healthcare career.
a healthcare career? Why don't you think, you don't have to become a physician, but you could be a physician assistant, or you could be, you know, some other type of allied health. We don't seem to share that information as much as I think we should.
Well, you know, it's interesting that you bring that up. I had a very profound conversation right here on Health Center, by the way, with Dr. Dawn Morton-Reyes, who just recently
She was our
the
dean,
chair. Yeah,
correct?
she was. When I was a student, she was the chair of the program, and she became the dean here of the College of Health-Related Professions, and now she's the president and CEO of NCCPA, which is our national governing body.
Oh,
and
wonderful.
the thing about it is we talked about this profession and particularly roles for women, because healthcare as we know it has made a dynamic shift. We don't see as many men. Years ago, it used to be just men for the most part who were doctors. And women have a more nurturing side to them. And I don't know for sure if really that's part of the reason why we've broken this glass ceiling. We're moving into other areas of careers and
sure
health
hope so.
where, yeah, where we were never found in such numbers before. And physician assistant happens to be one of those careers. I would like to even venture to say that one of the reasons may be because unlike going to medical school, as you mentioned before, you spend all these different years, you go to 4 years of school, then you have your residency there. You do this in 2 years and 3 months, albeit very taxing, difficult work that takes a lot of time away from family and friends and stuff. But if you're a woman and you're young or old, because our classes are very diverse. We have
There's no age limit.
There's not an age limit. When I was a student here, we had a woman in our class that she was got to be 48 or close to 50. All right. We have people who are foreign medical doctors who come to the United States and decide that perhaps that's not the direction that they want to go. They want to be a physician assistant instead, because it's the same level of pride that you have in your work. It doesn't matter. I don't need an MD behind my name to say to somebody, I can help you get over your depression. I can help treat your diabetes or your hypertension. I don't have to have an MD to say that, you know, you've got cancer. Let's see what we can do to help get you on the right track, that kind of thing. It's the same in here, you know. So we can start. The guidance counselors at schools need to know more about this profession. I know here at SUNY Downstate that our admissions department is very proactive in going out to different schools where they have these fairs, college fairs and career fairs, and talking about the schools here at SUNY Downstate, what we offer. I myself do it every so now and then. I've gone to some of the local high schools and talked about the PA program here and the PA profession.
Do you actually get students from doing that? I mean, when you reach, I know when I do outreach, I'm often flooded with calls afterwards. Does it work that way for you?
Well, they don't contact me directly. We refer them to the admissions department, and I'd like to think that my efforts don't, you know, go in vain. But I'm sure that we do get a fair amount of people that would follow up with that sort of thing, because a lot of people, as you say, really don't realize. When I walk down the hallway with my white jacket on, a lot of times just people say, because I'm a female, they go, nurse, nurse, nurse. And then I have to go and I have to say, no, I'm a physician assistant, how can I help you? And then when they sit down, and if they haven't read the label, they think that you're the physician, and you respectfully say to them, hi, I'm a physician assistant, how can I help you? I can do for you what the doctor would do. I will consult with the doctor, and the doctor has to still sign off.
Okay.
You know, we do consult with our sponsoring physicians.
Here's a question. I don't know if it's meaningful, but do you sometimes get people who say, well, I don't want to see the physician, says I want to see the doctor, the real doctor, or whatever.
And that's their patient right.
Well, okay.
That is their patient right, especially if they really don't understand. But what you'll find, say for instance here in New York, right here in Brooklyn, across the street at Kings County and here at Downstate, and a lot of the emergency rooms are basically PA run. There are a lot of services that are very much physician assistant run, and PAs are what we call ourselves for short. right? And the profession in of itself is not really new. There are over 100,000 PAs practicing in the United States, across
Really?
the United States in all 50 states, okay, including in Washington, D.C. And, well, not in Puerto Rico, but, you know, it's really taking off.
Okay, good.
There are quite a few schools, and new schools are cropping up everywhere. U.S. News and World Report consistently has physician assistant as one of their fastest top growing career paths every single year.
Well, that's good to know.
Over 191 physician assistant programs. Let me tell you how we got started.
Please.
There's a doctor from Duke University in North Carolina, because there was this profound need for more primary care doctors, and there was a shortage. So what they did was they took Navy corpsmen, and they trained them in the medical model. And they used these Navy corpsmen to help out in the hospital and to help expand the need to the community for healthcare.
When was that?
Right. They formed the first class in 1965, and the first class actually graduated from Duke in 1967. All right.
So
and
that's
it's
recent. That's within my lifetime.
Yeah. Well, it's recent, but it's not so new. I think more people than I probably like to say really do know what a PA is, but by far not enough people probably really understand exactly what we do. You know, once again, we interpret your labs for you. We'll send you on a referral. We'll follow up with you. We'll do surgeries. We can deliver babies. You know, all of that stuff. Practically anything that you can think that a physician can do, we can do, right?
Well, you know, and I work here, and I'm not even really aware of what physician assistants do. I had a talk with one of our faculty people who's in midwifery, and she was telling me the same thing, that midwives run the gamut of what they do in practice. Midwives can deliver babies, but they can also do well mother care and well baby care, and you know, there's all these other ancillary things that they do that we don't think of. We just think of a midwife being in the delivery room and delivering a baby. We just have a couple of minutes left, so I want to make sure that we can plug our program. So if there's any information, or a phone number or a website that you want to give for people who want more information about the PA program.
Yeah, so of course here for SUNY Downstate, they should go to the Downstate website. That's www.downstate.edu, and they should click on the College of Health Professions, and they'll see everything that they need to find out about what the requirements are for the program, when to apply, and there's a timeline there for people who would like to apply to the PA program. All the prerequisites and everything that they need to know are there. Once again, we do have a small faculty to student ratio. We have the largest medical library here. We have SUNY Downstate, very prestigious hospital that we're associated with. We have a full-fledged anatomy lab downstairs with real cadavers. That's something different that you won't find at every school. And we offer a host of wonderful programs here. It's a cohort. So when you come in, you go the whole 2 years and 3 months straight through to the end. And we're very proud. We have a very high graduation rate. Our students do extremely well on their boards, and I'm very proud of this program and glad to have brought it 180 degrees back around.
Well, I know that the proof of the pudding is in the eating, and a lot of our people, as you say, a lot of our graduates come back to practice here and come back to our faculty, so that's really the important thing. Julie, thank you so much for being my guest on today's show. If you're interested in the PA program, please go to the Downstate website for more information, and we will see you again on Health Center.